welcome to Digital Health Talks. This is Megan Antonelli, and I am so excited to be here with Margo Jordan, founder and CEO of Enrichly. I had the pleasure of meeting her at Health this past month. And today we're going to talk about one of healthcare's most urgent challenges, one that we talk about fairly often on health impact, which is childhood mental health. Our guest, Margo, as I said, is the founder and CEO of Enrichly, a digital therapeutic platform that's already transformed mental health outcomes for over 200,000 students. It's not another app. It's a closed-loop clinical system that combines evidence-based therapy, gamification, and parental oversight to build self-esteem as the foundation for democratized access to mental health care, where kids need it most. Hi, Margo. How are you today?
Hi, I am good. How are you, Megan?
Good. Was that stuff all accurate?
Yes, it was
Good.
pretty accurate. Yeah.
Good. Well, I am so happy that we're able to connect. I love when we go to a conference and we meet someone we connect with, and then we're immediately following up. It is, it's so easy to kind of get overwhelmed and come back and just get back into the loop of things. So I really appreciate you joining me on the show so we can talk about what you've done, what you're doing, and all about Enrichly.
Yeah, well, I am so happy to be here. It was such a pleasure to meet you and Andrea while at Health. It was my first time there, but y'all were so friendly. The conversations were so warm. So I'm excited to chat with you today.
Yes, and you had the opportunity to pitch on the impact stage there. So congratulations for that, because it's quite
Thank
an
you.
accomplishment to be on the stage there. But tell us a little bit, about your background, your history. How did you come to find Enrichly?
Yeah, so I grew up in Milwaukee, Wisconsin. And as a kid, I definitely say I kind of struggled with my own self-esteem. So honestly, Enrichly was born out of like this personal experience and deep observation around how self-esteem impacts youth and their development. I actually joined the military as a way to combat the low self-esteem that I had. I ended up studying finance, and then I kind of worked across youth programs in sort of different parts of, I would say, America. But I consistently saw this same pattern that kids who really didn't believe in themselves really struggled in a lot of areas. So academics, relationships, even their own happiness. So I really kind of had this aha moment when I realized that self-esteem is not just a nice to have, but it's actually like this foundation to mental health. And no one was really systematically building it. When you think about like Maslow's hierarchy of needs, self-esteem is number 4 on this chart. So my thoughts were, why are we not just teaching children, how to develop self-esteem?
Wow, that is amazing. And I didn't know that you had joined the military as well. That's amazing. Having seen you speak briefly and your composure, I'm not surprised. So kudos to you. Amazing. And it is, it's such a, I think the mental health problems of our youth in this country, it's becoming, it's getting to this point where, we have to do something. And the access level is becoming less and less, right?
Yeah.
Just harder and harder for people to get good help for their kids, and for kids, to take advantage of it in a way that they do because in a way that they want to.
Yeah.
So tell us a little bit about the approach and how it's different, and what that looks like for the child. Not
Yeah.
that.
So when I saw I had this aha moment, I really wanted to create this platform that was both engaging just as it was therapeutic. And because self-esteem is like the root to anxiety, depression, bullying, low academic achievement, so many other things, like these challenges stem from how a child sees themselves. So if we're not fixing the mirror that they're looking into, we're only treating symptoms. And I wanted to create a platform that actually build from the inside out. I don't think when I was in school, I even knew what self-esteem was. I didn't understand what that was until I was an adult. And then as I understood how important it was, I actually started to just think, well, why are we not just teaching self-esteem? I actually built a brick and mortar initially back in 2017 or 16. And it was a self-esteem learning center. It was an amazing center. We impacted a little over 10,000 youth around Houston. And then COVID actually shut us down. But during that time, we had a survey that we were using from the Center of Disease Control's website. And it was a self-esteem assessment built on a Rosenberg scale. So the CDC is actually using this and deploying this, and it's a way to measure self-esteem. And I just sort of thought, why not just measure our programs with this tool because it's, most widely used. And then we actually saw we had this statistically significant improvement in one's self-esteem. We would do pre and post. I recruited a couple of educational psychologists from local universities. They helped me with the research. And now I want to say fairly recently, we recruited a clinical psychologist from Universal Health Services. And, he was really blown away with the approach of only focusing on self-esteem as an initiator. And he had the same thoughts, honestly, and he's been doing this for decades. He said, well, self-esteem is definitely the root to a lot of issues that I see, but it's just not systematically taught. And that's why we decided to focus on self-esteem initially. But, as the platform grew, we decided to focus on other assessment tools and other engagement tools.
In terms of self-esteem, I feel like I should know more about this and have an understanding, but as you said, it's not taught, right? It's not taught in schools. But what is the, as you're looking at the kids and kind of doing the assessments, and then how you can, kind of create that impact. It does seem like it is a specific area where you can have impact, which is often more difficult with mental health. Talk a little bit about that in terms of why self-esteem is something that works in terms of the system.
Mm-hmm. So for us, self-esteem works because we're tapping into something that child has not really been exposed to. And it's really honestly not just a child, it's a person. If we have gotten so many requests from even adults when they see the platform and how it focuses on self-esteem, they say, well, can you do this for adults too? Because I'm pretty sure I can use this. And honestly, it's working because we're teaching that person how to love and value themselves. If everything forms around that, how that person loves themselves, how they care about themselves, how they talk to themselves, that is going to be shown externally. And we always tell our kiddos, everything starts internally. If you're having a bad day, you wake up and all of a sudden, your hair is all over your head, you're just not feeling it. You want to go back under the blanket, but you're forced to get up and be in the world and show your face. How do you think that person is going to show up in the world? They're not going to show up as their best and brightest self. So therefore, that's going to affect how they interact with other people. And it's not just like this for children. It's like this for adults, right? If you wake up as an adult and you're like, oh, I'm just not feeling myself today, that is going to impact how you show up with your colleagues. For students, how they show up with their peers, how they interact with their parents. All of that is stemming from how that person is feeling about themselves, as opposed to they wake up feeling amazing. They say positive affirmations in the morning. They look at the world with a big, bright eye, and they are really loving themselves. That is going to demonstrate itself externally. So now everyone they meet is going to meet this bubbly person that's smiling and have a great day. And you have no idea how much of a difference that makes from someone who looks at themselves in a sort of not loving themselves type of way to, okay, I love myself in everything that I do, and I know I can accomplish whatever I set my mind to. And honestly, this is why we see that Enrichly works.
Mm-hmm. And so in terms of their experience of what they're doing to kind of, that you're educating them about self-esteem and building self-esteem, I know that there's a gamification element to the platform. Talk about that a little bit in terms of how you can, sort of get the kids involved that way.
Yeah. So it was funny because when we transitioned away from the brick and mortar was so much fun. It was an experience, right? And I had to put this experience online. And I'm like, okay, well, how do I do that? Because I don't want kids to read like a boring PDF or look at some boring slides. So what do I do? And I thought, well, kids love video games. I have kids and they're always playing games. So I thought to myself, well, I think I can just like put all of this curriculum into a game. I can build these characters and these characters can talk about self-esteem, et cetera, et cetera. So imagine a child is logging into Enrichly and they step into a game world that really mirrors their real life challenges, but it's actually giving them the tools to conquer those challenges, right? So this is through avatars, quest, progress tracking. So we are making this therapy fun. So gamification really lowers the resistance, and then kids are engaging a lot more deeply when they feel like they're playing, not being treated. So we have our clinical psychologist, my co-founder, his background is in psychology. They create the curriculum and make sure that it reaches the objectives. We have these therapeutic principles, embedded cognitive behavior therapy, positive psychology. They're in all of the games, but kids wouldn't know that they're being treated because it's a game for them. And that's how the experience works.
Yeah, I think that it's so critical. And I think in terms of, having young kids myself and knowing that what they're willing to engage in, what they're willing to do, especially for their own, sort of self-help of it all, it's got to be fun. I mean, they're so, sort of in these dopamine cycles that are, but also having negative impact on their self-esteem. So to at least replace it with that. And I mean, I've been doing a lot of thinking lately. There's so many books out there. There's so much about this adolescent mental health crisis and what screens have to do with it. But on the other hand, very little to say, this is how you help. This is how you do go on a digital diet in your home, and things like that. And these are things that you can replace that have a positive impact, because the screens aren't going away. We're going deeper and deeper into this. So ensuring that the screens that they are engaging with are good for them, I think is such a critical piece of that, which is what excites me so much about the fact that you've had such great impact. So, I read, over 200,000 students. Tell us a little bit about how you're getting to those kids. Are you partnering with schools? Are you partnering with insurance companies? What's your sort of the business to Enrichly?
Yeah. So when we initially launched, we had a lot of partnerships with schools and districts. It was funny. We had a lot of principals and superintendents to come into our brick and mortar, and they were hosting things for either their child or their students. And they said, hey, can you come and do this at my school? And it was very I wasn't expecting it, but the first interaction that we had with the school was when they asked us to come in with 500 fifth graders, and they wanted us to deliver a self-esteem development program to them. This was pre-technology. So because we had that experience with those schools and those districts, when we introduced the technology and the games, they absolutely loved that. So that allowed us to go into these schools. We built a very low cost prototype. It probably was about less than $20,000 that I spent on this. And that actually led to our first, really our first six-figure contract, second six-figure contract, and about almost $1 million ARR, just, focusing on schools and districts, because this was a need. This was right after COVID. Funding was flowing, but then it stopped and we had to make a pivot. And now we actually sell the same tool. We just sort of reconfigured the technology, but we sell it into health systems. So we actually just partnered with Wellstar Health out of Georgia, their community health team. They were really looking at how they can bridge that pediatric behavioral health gap. And Enrichly just sort of is a plug and play option for them. We offer training to their community health workers, and then they go deploy the technology into their communities. So this is churches, Boys and Girls Club, Girls Inc., schools that they work with, Rotary clubs. And all of these are organizations that focus on youth in some capacity. And now they get to offer these self-esteem programs powered by our technology, where at the end of the day, our partners, and these are the payers, health systems, they get this really cool impact analysis report at the end of the year to say, because this is what you did, you impacted 10,000 kids. You saw a 90% reduction in reduction in anxiety and depression. You saw a 78% increase in self-esteem. And then we also include like some social determinants of health, but they get these really cool reports that they really have to demonstrate for either their health system, IRS, in order to make sure they're keeping that status. And long-term goal, we want to work with health plans because we know we're helping to save money when it comes to screening early, intervening early. We're more preventative versus reactive. But yeah, now we mainly work with health systems and we help them to plug in our solution to bridge the pediatric behavioral health gap.
Amazing. Yeah. And that's, I mean, I think the school fit obviously so clear, especially coming out of the pandemic and what was needed, but the health system to get them involved, that, sort of scales it in such a different way. What is that kind of point or that threshold of need where they are bringing in Enrichly, and how is the clinician then involved?
Yeah. So there are two entry points. So with like our community health teams, they're looking at how they can deploy more behavioral health into the community. So they simply pay for Enrichly to be deployed across their communities, and they send someone out to implement the programs. However, within another vertical in the health system is the pediatric service line. And this is where the clinicians are more involved because think of a child that comes in for a well-check visit. And if they're over a certain age, they are required to give that child a mental health assessment. So now they're using our platform to deploy that assessment, but now we get to pair them instantaneously with a gamified intervention that was created by a child therapist, because there's a lack in 70% of countries around the US. They don't have a child therapist. So right now, when a child is flagged, right, they give the referral to the parent and say, okay, you can call this therapist for your child's anxiety or depression issues. And then they're having to wait 6 to 7 months, sometimes longer. Sometimes parents don't even follow up. So now, as opposed to like them missing that opportunity altogether, you get the assessment and then we pair you with an intervention that's personalized to whatever that child's struggles are.
Oh, that's great. Yeah, I mean, it's an incredibly difficult path to navigate. Unfortunately, I have many friends who have struggled with trying to get their kids' mental health help. And it's just, affordability, access, even here in LA, like just not enough. No one has time to meet with anybody because everybody needs it so much. And there's just not that there. And then there's the process of getting these kids to actually go to that when, they're starting to understand that, telemedicine is a thing, that they can see doctors and physicians online. So being able to, access that type of help over the phone, through their phone and through their devices, is amazing. Now, on that flip side, you have the screen time issues and things like that. Where do you guys sit on that in terms of how that works? Particularly if we say, well, the phone is maybe part of the cause of your self-esteem problem. So we need to take it away. But of course, it's not the phone itself. It's not the device. It's where they go, right?
Exactly.
But tell us where they go about that. Yeah.
So honestly, and this is what I tell parents and even some clinicians, it's like, we're not asking for more screen time. We're asking for better screen time because we know that the devices are not going anywhere. Children are going to have a tablet. They're going to have a phone in their hand. So if your child is already spending these hours on YouTube and TikTok, why not, or wouldn't you rather have them spend 10, 15, 20 minutes on a platform that's actually building their mental health? We actually did something with the government of Abu Dhabi, and there was a parent workshops that we were doing, and the parents were walking up, and her daughter was really interested in the game, so we let her demo the game, and then we were wanting the parent to sign up, and the mom said, well, I only let her have her tablet on Saturdays for a couple of hours, and she usually spends that time watching YouTube. So I asked the kid, like right there, I said, okay, would you rather watch YouTube or would you rather play Enrichly? And she literally said, oh, I would much rather play Enrichly. And it was such a cool thing to see the kid actually say that. And it wasn't just something that we made up.
Yeah. Well, it's an interesting thing too. I mean, as I've been thinking about these digital diets and what does that mean? And, kind of, I mean, as I've got kids, my son is in high school and it's like, I can't take his phone away. It is his lifeline. I mean, I could take his phone away, but I mean, it's how he gets out of the house. It's how he has a social life. So where you look to try to control it, and maybe there's a way, I don't know whether it's part of the Enrichly, sort of, but like if they do more time on Enrichly, they can earn time on the other apps,
Oh yeah. Oh yeah.
Much the same way as like you eat your vegetables, you can have dessert,
Yeah. It's
but
funny. We tell parents, we are hiding the vegetables in the candy.
right. The broccoli and the muffins. Exactly.
Yeah.
Been doing it for a while. Yeah. So no, but so interesting. And then as you, kind of begin to explore the avenues to the payer side of this, getting involved with the health plans, what's sort of next? Where do you go beyond the healthcare systems and the employers? What's your, in terms of this model? And I guess to some degree, another question I have is there a particular age that you're focused on, or is that, and is that part of that pipeline?
Yeah. So to answer the first half of your question, which is like, where do we go? Honestly, our goal is to become approved Medicaid vendors in all 50 states. Not saying that we are billing Medicaid directly right now, but we want to be seen as something that is compliant with Medicaid standards. We already have our MPI, and all of our providers and partners, they are the ones that are typically billing Medicaid for our platform because there are CPT codes that they can use to get that reimbursement when it comes to like the medical diagnostic and then them actually assigning those interventions to that child. We are right now, we're focused on K through 12. However, we want to be able to offer adult content on the platform. And that means, and we kind of started, but this is a closed loop system that can not just be used for a child, it can also be used for adults because adults have, just as many mental health issues, if not more, than children. So, being that go-to closed loop system that's really helping to improve outcomes, partnering with payers in every state to deploy a simple solution. We're definitely cutting costs when it comes to the behavioral health workforce because you don't need people to run the platform. The people already built the interventions. They live on the platform. So we don't have to hire employees. We don't have to 1099. A lot of these telehealth platforms, which are great, but they're very reactive. Our solution is proactive, it's preventative, and it's really meant to be sort of like a value-based care solution. And something that can grow with that individual because it constantly personalizes the experience for that person. So yeah, approved vendor status, really partnering with payers. One of our goals in the near term is for some of the states that we're working with is having Medicaid deploy Enrichly amongst their FQHCs because we know that they don't really have the funding to pay, but they have one of the highest needs. So, partnering with payers, getting this into the hands of as many kids as possible. Our school-based programs, we have not tapped into that yet. However, I know that it's on the roadmap and it's coming. We actually just won something recently called Prime Health Innovation Challenge of Colorado. And that led us to now partner with one of Medicaid's arms in Colorado to pilot our program so that we can then obviously demonstrate the outcomes so we can finally have a Medicaid partner alongside us.
Right. Well, I think there's so much opportunity there. I mean, with the schools, whether it's through, I know here in LA, there was a big push towards mindfulness, right? And I think it was Goldie Hawn's program with the meditation and all got into the schools. And it was it was very widely adopted for a bit. And then I think the pandemic happened and now it's just not as much there, or in some cases fully embedded. But when you think about the guidance counselors and how often, these schools do or don't have enough guidance counselors to meet the needs, but also do kids fully take advantage of it, right? And if they had more tools in the toolkit of what they could do besides, come in and meet with the guidance counselor, which, feels and frankly is, sort of that 1950s, solution of it, and that no kid really wants to do. They, the guidance counselor is literally sitting next to the principal's office. So why does it feel like the right, the right best solution? Where there, and to sort of have these other options is so good. And then in terms of health systems, so with our audience being predominantly health systems, if they're listening, what's the way for them to get involved? Like, what, do they reach out? Do they, what's that right path?
So go to our website. It's www.enrichly.world. And just request a demo. You can also email me, margo@enrichly.world. And, see how we can be embedded into your health system. We love working with pediatric service lines and community health teams. It's a really great solution for both verticals when it comes to cutting costs and when it comes to helping to meet their community health need assessment goals. And those are I want to say the best ways. You can also reach out on LinkedIn, Margo Jordan.
Perfect. Yeah, no, I think there's just so many avenues for this. I mean, we've been partnering with a number of different organizations that are tackling this. And I just think, while there's a lot of attention and a lot of discussion about the problems,
yes,
there's not a lot of solutions. And that even if the tools are there, getting access to them and making sure that they're available, is tough. So I appreciate you being here and joining us today. And I encourage our audience to reach out to Margo. She's incredibly accessible and a great person to talk to and kind of learn about this world and what can be done. So thanks so much for joining us, Margo.
Thank you, Megan. Thank you so much for having me. And I am excited about the future of Enrichly.
Yes, me too. We'll have to see you in Houston soon and on a health impact stage very soon. So I appreciate it. And to our listeners, thanks so much for listening. Do not hesitate to reach out to Margo or me to get in touch. And, I think there's so much for us to do in this space to help our kids and to certainly help, around self-esteem and building that for our children. So thanks again for listening. This is Megan Antonelli, and that's Health Impact Digital Health Talks signing off.